Diagnosis. A hernia is typically diagnosed through a physical examination, which is normally the first step in diagnosing a hernia. During the examination, doctor will examine the affected area and check if there is any sign of hernia such as bulge or protrusion, etc. The doctor may also ask to the patient to do certain movements like cuffing, bending, lifting, etc. so to check if the hernia protrudes. Doctor may also ask number of questions like bulge, when it was first noticed, symptoms, if there were other hernia symptoms, family history of hernia and lifestyles, smoking, if there is any history of smoking, exercising patterns, whether rigorously, occupation involving heavy lifts, etc. To diagnose a hernia, there are several tests. Ultrasound uses high-frequency sound waves to create an image of hernia, its size, location, etc. CT scan, computerized tomography, combines X-rays and computer technology to create detailed images of the affected area. MRI, magnetic resonance imaging scan, uses a powerful magnetic field and radio waves to create detailed images of the affected area. An MRI can check a tear in the abdominal area. Herniography, injecting a contrast dye into the area around the hernia and then taking X-rays to visualize the hernia and assess its size and location. Endoscopy, in this a thin, flexible tube with a camera is inserted through the mouth into the stomach. This can be used to visualize a hiatal hernia and assess its size and location. Treatment. The treatment of a hernia depends on the severity of the condition and the presence of any complications. In some cases, hernias can be lived with simply through watchful waiting. Doctor will monitor your hernia regularly for possible complications. A truss, supportive undergarment, that may hold the hernia in place may be advised. But it is recommended to check with doctor first, as it is critical that the truss fits the patient properly. For hiatal hernia, over-the-counter and prescription medications that reduce stomach acid can relieve your discomfort and improve symptoms. These include antacids, H2 receptor blockers, proton pump inhibitors. If the hernia is developing or painful, then doctor can recommend for surgery. Hernia repair surgery can involve open surgery. In this surgery, the surgeon makes an incision near to the hernia site, pushes the bulging tissue back into the abdomen and closing the defect. Sometimes fix it with surgical mesh so to help to strengthen the area. In this procedure, doctor normally uses local anesthesia and sedation. Laparoscopic surgery. In this type of surgery, doctor make a few small incisions, 4 mm to 12 mm, and then a long instrument with tiny camera is inserted to perform surgery under general anesthesia. The hernia is then fixed, and mesh can even be placed through these small incisions. It should be also noted that laparoscopic surgery is not suitable for all hernias. Robotic surgery. This type of surgery is similar to laparoscopic. In robotic hernia surgery, a small incisions are required. During robotic surgery, surgeon controls all the time and uses tiny instruments and 3 dimensions, 3D, images of the abdomen. In robotic surgery, there is small scars and maneuverable, thus reducing tissue damage, blood loss, less pain, and there is also faster recovery. Thank you for watching my video. For more videos, kindly like, share.